Is it important where a woman goes to get their mammogram, and what should they be looking for when they're going to choose a center or a place to have mammography?
So what is helpful is to look at what kind of equipment they have at the center. That's one thing. We have 3D mammography at the Margaret W. Needland Breast Center. 3D mammography finds 41% more invasive cancers just because of the sheer fact I can go 1 millimeter at a time through the breast instead of one stagnant picture. It really breaks it up into 1 millimeter increments in each of the 4 views. And that's no more radiation than just a regular 2D mammogram. So having good equipment, a center that's accredited, you want to make sure that your technologists are doing a lot of mammograms, not a radiology technologist that's maybe doing a colonoscopy and then comes over and does a mammogram or whatever. Maybe not having a technologist do other kinds of exams and then coming back and doing an occasional mammogram. So excellent positioning is something that is second to none. You need excellent positioning. And then who's reading your films? You want to have, I would imagine, a board certified radiologist with a subspecialty in mammography is found to find smaller cancers. So it matters what kind of equipment you have, who's positioning you, and then who's reading your films.
So tell me, I understand at the Margaret W. Needland Breast Center that, there's the radiologists, people like yourself, breast imaging specialists, but there's a whole team there. Tell me about the team at the Needland Breast Center and the resources that you bring to women.
I'm really proud of that. I think that I've been here for now 2 years, and I've watched a whole team morph around our patient and their needs. So we could have a patient come in for a screening mammogram and we'll see an abnormality on her films. I'll go ahead and talk with her and we'll move her right along through a diagnostic. And if it's an ultrasound finding, I can go ahead and do the biopsy right then. Also, patients where I can look at their family history and I can see that she may have a genetic propensity for what I think is going to be a cancer. She can go right upstairs and see Kathy Marinac, our genetic counselor, and start that piece of the puzzle. I'll also get in our nurse navigator and our social worker, especially if they have issues with maybe their insurance. So those are, or personal situation going on. So having a whole team is incredibly valuable to patients as they're doing their walk. It can be very overwhelming, but we have a team that comes along beside a lady and carries her all the way through her treatment and then beyond.
As a breast imaging specialist, are there any developments that you see on the horizon for breast cancer that you think are promising or that women should know about?
For breast cancer, Another thing that I'm very proud of at our center is how we're treating small breast cancers, oftentimes with intraoperative radiation therapy. So a patient can go to the operating room, have her surgery taken out, during surgery have her cancer taken out, and then have radiation and wake up and kind of be done with her treatment there and having it, instead of having it stretched out over 6 weeks. And that's very cool. What I'd like to see at the Women's Center, I think what I'd like to next adopt is doing fast MRI sequencing, so we can maybe offer that to more patients at a lower cost and get even more women screened that need to be screened, who have dense breast tissue and who have family history.
Wonderful. Well, Dr. Linda Frey, Medical Director of the Margaret W. Needland Breast Center at Jupiter Medical Center, thank you so much for joining us.
Thank you.